ìpínlẹ̀ Èkìtì wojire ilẹ̀ yìí ilẹ̀ yá lèkìtì ṣe oyè báyìí mọ̀ dúpọ̀ yìí gbìyànjú sílẹ̀ kámúbàrún olèkìtì ayélujára jùyà. Èkìtì lọ́mọ olúṣù àrògùrò fẹ̀wọ̀ ọmọ olóṣè méjì takọtabo. Ìgbélárugẹ oúnjẹ àgbẹ̀dàgbàsókè lóríkò. Èkìtì ní alára ọgbà ẹ̀dá òye. Ìṣèjọba kan dára ògbáyé gbádùn ara wò. Èkìtì ní alára ọgbà ẹ̀dá òye. Ìgbélárugẹ àṣà àti ìṣe àtúnṣe bí ìgbafẹ́. Èkìtì ní alára ọgbà ẹ̀dá òye.
A warm welcome to you out there, and this is Ekiti on the move. I am Tunji Saliu. Clean water and sanitation occupies a prime of place in the 6th position of the 17 sustainable goals in the United Nations adopted development goals. Ekiti State did not just buy into these goals, but has over the years built frameworks and initiatives to make its citizens beneficiaries of the impact of the goals. One of such initiatives is the Sustainable Urban and Rural Water Supply, Sanitation and Hygiene (SURWASH) program, an initiative supported by the World Bank to improve access to clean water, sanitation and hygiene. In Ekiti State, the agency saddled with the responsibility is the Ekiti State Small Towns Rural Water Sanitation and Hygiene Agency, EKRUWASA. Its work and impact traverse the 3 senatorial districts of the state, delivering safe, clean, accessible water and sanitation to critical sectors of the rural populace. This is our focus on the program today. Let's get into it right after our news highlight segment. Quick takes.
Ìpínlẹ̀ Èkìtì wojire ilẹ̀ yìí ilẹ̀ yá lèkìtì ṣe oyè báyìí mọ̀ dúpọ̀ yìí gbìyànjú sílẹ̀ kámúbàrún olèkìtì ayélujára jùyà. Èkìtì lọ́mọ olúṣù àrògùrò fẹ̀wọ̀ ọmọ olóṣè méjì takọtabo. Ìgbélárugẹ oúnjẹ àgbẹ̀dàgbàsókè lóríkò. Èkìtì ní alára ọgbà ẹ̀dá òye.
Water is life. And here in Ekiti, nature has blessed us with abundance. From Arita's roaring falls to the gentle rivers carving our valleys. But abundance in the landscape does not always mean access to the tap. For generations, many rural communities watch clean water flow past them, close but out of reach. That story is now changing. This is the story of SURWASH, a quiet revolution of pipes, policies, and the people. One small agency with just 45 staff is taking on a giant task, bringing clean water and safe sanitation to millions across Ekiti State. What is SURWASH? In 2022, Ekiti became one of 7 states selected for the World Bank-funded SURWASH program, and that is the Sustainable Urban and Rural Water Supply, Sanitation and Hygiene project. It is built on a radical idea: pay for results. Unlike traditional loans that releases money upfront, SURWASH requires the state to meet specific targets first. Only then does the World Bank disburse funds. This approach has always brought nearly $7 million into Ekiti, and the project has been extended to 2028.
You already know that SURWASH stands for Sustainable Urban and Rural Water Supply, Sanitation and Hygiene. Fairly long words. That's for SURWASH. And it is part of the WASH efforts of the state. It's a specific project under the general WASH project of the state to ensure, one, that there's water for everybody in the state, and that the sanitation and hygiene for the state is good. So this particular project is a program for results project funded by the World Bank. It's a particular loan in which 6 states, it started about, I think, 2022. It was going to go to 2027, but it's now been extended to 2028.
Ekiti State happens to be the only southwestern state. We have Delta, we have Imo State in the southeast. In the north, we have Kaduna, we have Katsina, we have Gombe, and we have Plateau State. Just recently, in April 2026, there was a restructuring and additional 7 states have been added, including FCT. So we totally have 15 so to say, states that are participating in the SOWASH program now. Inception of the program in January 2022, the states were made to enter into a criteria to select local governments. So we call them the prioritized local governments. So out of the 16 local governments in Ekiti, 9 of them were prioritized. And these were based on maybe there were prevalence in diseases of water-related diseases. So we have 9 of them. We have Ado local government, we have Moba local government, Irepodo Ifelodun, Ijero local government, Ayekire, Oye local government, Ilejemeje, Irepodo Ifelodun. So those are the selected prioritized local governments across the 3 senatorial districts in the states.
The goal is in twofold: strengthen policies and institutions so that water infrastructure lasts, and improve access to clean water, sanitation, and hygiene for everyone, whether they live in rural villages of fewer than 5,000 people, small towns of 5 to 20,000, or urban centers served by dams like Ero and Ureje.
ìpínlẹ̀ Èkìtì wójúre ilẹ̀ yìí ilẹ̀ ẹ̀yà lèkìtì ṣe oyè báyìí mọ̀ dúpọ̀ yìí gbìyànjú sílẹ̀ kámúbàrún olèkìtì ayélujára jùyà.
To achieve this, Ekiti first passed a new water law recognizing water as a natural asset for all citizens. The government created a regulatory agency called WASRA and transformed the old Water Corporation into a registered company.
Ekiti State started reform program way back in 2012 with the approval of the first water and sanitation law in Ekiti State. So in 2018, the federal government launched what we call National Water and Sanitation Revitalization Program Plan that will help Nigeria to achieve the SDG. In addition to that, there was the Open Defecation Plan roadmap that was launched. And Ekiti was one of the first 4 states in Nigeria that domesticated all these reform exercises and reform procedure in the state. So by that time, the government was looking at how would they fund overall the basket of investment that water sector reform will require in Nigeria. So the first condition was that states that are actually undergoing reform in the sector will be eligible for consideration under the new program of SOWASH. Again, states that have domesticated or the reform that have been implemented at the national level, that is the Open Defecation roadmap, that have signed commitment to the National Action Plan or revitalization of the water sector, will be given the first of place. So after a long process, compliance and verification exercise and negotiation of the process, the state was selected as one of the 7 participating states in Nigeria.
These institutional changes ensure accountability. On the ground, 9 priority local governments were selected across the 3 senatorial districts. In these areas, the state has built solar-powered boreholes, renovated abandoned wells, and constructed toilet facilities in 55 schools and 55 health centers. More than 275,000 people have already been impacted, and over 275 communities now have clean water.
The program is about improvement of water, sanitation, and hygiene across the state. And my agency is the agency saddled with water and sanitation in the small towns and the rural. The small towns are communities that are between 5,000 and 20,000 people residing there, while the rural communities are termed as communities having less than 5,000 inhabitants. So my agency takes care of the water and sanitation needs and the hygiene needs of all these communities. And like you can see, Ekiti State has a very large percentage of people residing in the small towns and the rural. So that is why my agency is a very important component of this SOWASH, which is Sustainable Urban Rural Water Supply. What we first of all do is to have a baseline of all the water and sanitation that are in all these communities. Now we'll be able, from the baseline, we'll be able to know the shortfalls. Then we'll be able to know which area needs what in sanitation, which area needs what in hygiene. The way we provide water facilities is through drilling of boreholes, maybe the hand pump boreholes or the solar powered boreholes or the motorized boreholes. And then we build toilet facilities for communities, maybe in the motor parks, in schools, in health centers, and things like that. Then we also carry out a lot of sensitization to the people so that they can build their own toilets. So that is how we intervene. And the people have been coming to us, and we've been going to them. And this agency manages hundreds of boreholes in the state, across the whole state. And we also have quite a number of sanitation facilities that we manage.
But infrastructure alone is not enough. The agency responsible for rural and small town water owns a fully equipped mobile laboratory that tests water on the spot for bacteria, pH, and heavy metals. Every borehole is placed far from dump sites, suckerways, or cassava processing areas. Before drilling, a geophysical survey determines depth and water quantity. Only then do teams install hand pumps, solar systems, or motorized reticulated networks.
So we also look at the plan of the area. You just site a borehole in the middle of the street or a potential street or things like that. So that we look at the plans, we look at everything. Then we carry out what we do call geophysical survey. Not everywhere has water. Water is like when you look at the river flowing, it meanders. That's what also happens underground. Water underground also meanders. So what we do is that we do the geophysical survey first, a very good one. It will tell us the depth where the water is, tell us the quantity of water there, and it tells us some other information. That is what we're going to use in siting the borehole there. We also have a laboratory here where we do quality control analysis. Now, this mobile laboratory, what it has is, we call it some equipments that like the spectrophotometer. We have a generator there so that we can go to sites and carry out water tests. So when we do these tests, we do for all these boreholes around, then we carry out disinfection of the boreholes also. So what we do is we take samples of the water, perform the test. There are some tests that you have to perform on site. Like you do the pH, you do the turbidity and things like that you can do on site. Then when you want to carry out the major ones, you bring them to the laboratory here and do it. Then we also partner with an agency in the States called the Water Regulatory Agency. They have a very big laboratory, bigger than ours. So sometimes we do more precise analysis with them. But then our mobile laboratory goes around both the rural and the small towns to take water samples, analyze, and when we find out that one of these boreholes is contaminated, the next thing quickly we disinfect and do all other remedies to make sure that the people get water. So we thank God for the state government has been supporting us. They bought the vehicle for us, they equipped it for us, and under the Soil Wash program, and it has been of very, very immense benefit to our agency.
Sustainability begins with the people. In rural areas, community elect a washroom, a water, sanitation, and hygiene committee. Each committee is for maintenance, and every facility gets a village-level operation and maintenance toolkit for minor repairs.
You see, all these facilities that we build, they must have the community buy-in in all these things. Because when you put a borehole somewhere and the community, they are not there to take ownership, it leads to the breakage or malfunctioning of these facilities.
We make sure as the policymaker concerning Soil Watch here that everything that needed to be put in place is being done. Concerning the PIR and PIAP, we make sure that everything is put in place for the IAs to be able to carry out their assignment as at when due, and to do it diligently, and to make sure that what they are doing is sustainable, not just to build infrastructure and just to leave it like that, but to make sure that what they are doing lasts long and people are beneficiaries of the project they are doing.
We have small town and rural. In small town, we have some people, we call them WCA, Water Consumer Association. They comprise about 7 or 9 odd numbers. Those are the people that man all the water facilities that are in the environment. They are the ones that will be looking into it. If little thing happens to it, we have some people, we call them LAM. LAM means local area mechanic in their domain that they will first report to. They are the one that first of all go there to do it. If assuming they can't cater for it, they can call us. That is that. For rural, we have them as WashCom. WashCom means water supply and hygiene committee. They are the ones that are doing the same thing. We call them maintenance people. They are the ones that are maintaining it for sustainability.
Major problems are reported through a grievance redress number posted on every borehole. This way, water keeps flowing long after the project team leaves. The state pays first, the agency builds, and the World Bank inspects, counting beneficiaries and testing water quality. Only then does the bank refund the state, and that money is immediately reinvested into more boreholes. Last year alone, the agency achieved nearly 90% budget performance, and over 1 billion naira was recently approved for 3 new schemes that will serve 80,000 more people.
First of all, put in your money. The state government first of all puts in their money, then the World Bank checks and refund the money back to the state. It's a loan, but it's a kind of loan where we perform first, not unlike before where they give you the money up front. You go and do whatever you like. No. So if you drill a borehole now, you know what they will do? They will now count the number of people benefiting from the borehole. They will interview them, check the borehole, check the water quality, check everything, count the number of people, then pay you according to the number of people that are benefiting from the hole. You understand? So that money that you get, the state government will now use it, plow it back again into the wash sector again, and more boreholes will be built. Presently, we are doing 3 water schemes, worth billions of naira. We have one at Odwoja in Ikere, we have one at Ekiti, and we also have one at the Kogosi regional sector. It is about 70-75%. All of them are 70-75% completed. Next 2-3 months, people will now be benefiting and getting water. What the government is doing is making sure that every sector, every part of the state is equally represented in the program. You understand? Although we have prioritized local government, but the state government is looking far beyond that. Is also making sure that when you build a borehole, for example, in Ekiti, you must also build one in Omo. You must also build one at every part of the state. All the local government and LCDAs must equally have all these things.
ìgbélárugẹ àṣà àti ìṣe àtúnṣe bí ìgbafẹ́. Èkìtì ní alára ọgbà ẹ̀dá òwe. Èkìtì ní alára ọgbà ẹ̀dá òwe. Èkìtì ní alára.
At a primary health center that once had no water, a matron describes the old days, patients and staff running into the bush, no water for delivery. Now, she has water, a toilet, and dignity. 55 health centers and 55 schools have received similar facilities.
We have been struggling for long to have water, to have toilets. Even many times if we have patients, they normally run to bush. The staff normally run to bush. Then we normally suffer for water. We used to go far from a facility to get water. But since the time that they have done this project, the water and the toilet, so everything has been easy for us to fetch water, very easy to take care of our health facility in terms of cleaning. Is very convenient for us. Then in terms of toilet, everything is easy. We have the male apart, we have the female apart. So, and everything is working perfectly. We don't have any issue on it. When we have delivery, it's convenient for us. They will shower, we use water to do necessary things that we're supposed to do immediately. Even the water serve the people in the community also. Wọ́n dẹ̀ ti ṣe omi fún wa. A dúpẹ́ lọ́wọ́ ìjọba báwo pé à ń gbádùn omi. Kò sígbà tá a débi tí a ò rómi pọn. So a ò sọ́fà omi rárá. Torí bí last year wọ̀nyẹn a máa ń sọ́fà omi gan bẹ̀ tí ní yẹ̀ báyìí. Omi ó sáfù gbogbo àwọn àdúgbò wa. Even gan kì í ṣe àdúgbò yìí nìkan, wọ́n máa ń wá láti ìsàlẹ̀ lọ́hùn wá pọn omi níbí báyìí. So a dúpẹ́ lọ́wọ́ gan pé wọ́n ṣe é o.
Before we are having well water. So and it's not convenient for clients and the staff for us to fetch water in the facility. Most of our toilets have been damaged. We are repairing it, but still there is no good toilet. But now we can get a good toilet for the clients, even for the staff also. We are enjoying now. We are enjoying the good source of water supply into our facility.
Wá dúró ti sísítà mi tó bímọ. Mi àti tọ́lẹ́tì tí wọ́n ṣe, ó súnmọ́ra, ó wà òkè. Ó rọ̀ wá lọ́rùn.
Ìgbélárugẹ oúnjẹ àgbẹ̀dàgbàsókè lóríkò. Èkìtì ní alára ọgbà ẹ̀dá òwe.
This provision of toilets, the building has helped a lot. Both the staff and the patients can have access to toilets, and this has prevented open dumping of feces or any form of waste. Before now, we haven't been having access to water, adequate water, but now, thank God that the governor has provided us another new borehole, which is perfectly working, and we have access to adequate water.
Children learn hand washing and girls stay in school because there are locked toilets with running water and sanitary disposal bins.
It has helped us in a lot of practicals because it's very, very important for washing our apparatus and also for a lot of chemical reactions. Like a lot of the things that we do need water. It's not possible for us to take part in any reaction without using water. So water has been very, very useful, especially as science students.
Very helpful for us, especially to the girls. Whenever there's no water in the school facilities, we are going to come here to fetch our water. So as to do our domestic chores inside the hostel and do some other things to wash our clothes, to bathe, that's all.
We have well before, but we don't have functioning toilets. But by the time they built this one for us, we are really glad. We are so happy because it was functioning well good supply of water for pupils and teachers. At least we have good drinkable water and for toilets at the same time. So we are so happy about it.
That other old toilet, you used to go to the tap, fetch water and flush it. But this one, once you finish toilet, you just press the button on it and it will help you flush it. Then you come out and wash your hand here.
On behalf of the HM of the school and the entire pupils of Holy Trinity Northern Primary School, Ekiti, we really appreciate the state government for these projects, and we plan to make better use of it.
Is our waterborne diseases are defeated. One clinic, one toilet, one tap at a time.
Since we started 2022, we have done hundreds of boreholes, you understand? So more people have access to clean water, thereby reducing the prevalence of waterborne disease and everything. And then we also have committees where we sensitize the school children, the school-based management committees, where we teach them how to take care of themselves, menstrual hygiene, all these things. So those are the kind of things we're doing. So by extending the program is a very, very welcome development. We have more facilities the state government will have more facilities to build for the people, and many more people will benefit, thousands of people will benefit from better water supply, hygiene and sanitation.
From policy table to last mile, across all 16 local governments, the tide is turning. Clean water, safe toilets, hygiene for health. That is the Ekiti Soil Wash promise. Honored every day by 45 dedicated staff, one supportive governor, and thousands of communities saying we will maintain what we own. This is the Ekiti State Government Soil Wash World Bank assisted program. Water is a natural asset. Every citizen must have access. The Ekiti State Governor, Biodun Oyebanji, remains committed to this.
The project is ongoing, and definitely more communities are on the way to benefiting from these life-enhancing initiatives, a true testament to the shared prosperity vision of the current administration. Thanks for watching the program. Please note that you can watch this episode or any of the previous ones on our social media platforms showing on your screen. Please, let's also have your feedback through the same channels. Until next time, goodbye.
Ìpínlẹ̀ Èkìtì wójúire, ilẹ̀ yìí ilẹ̀ ẹ̀yà lèkìtì ṣe, ó yẹ báyìí mọ̀ tó bóyin gbìyànjú sílẹ̀, ká mú bàrún olèkìtì ayé mi ń jẹ́ jù yá.